Hello, everyone. Greetings for the day. I'm Priyanjali from All About Skin Wellbeing. I'm sure all of you must be keeping good health. We all know taking good care of your skin is important for more than just your appearance. As the largest organ, your skin becomes the most essential to your overall health. A fungal infection is very common on your skin or nails. Fungal infections or mycosis are diseases caused by a fungus, yeast, or mold. Mild fungal skin infections can look like a rash, can be itchy, and annoying. So let's connect today with our skin expert, Dr. R. Indhra Priyadharshini, live from Chennai to enlighten us on the topic of fungal infection. Dr. R. Indhra Priyadharshini is MBBS, MD, DVL, consultant dermatologist, and she has rich experience in this field. She is currently practicing at Shine Skin Hair Bones Clinic, Chennai. And today we are with her on the screen. I would like to welcome you to today's screen, Doctor. A very, very warm welcome to you. And with that, let's dive into the first question. Let's explain in very basic language what is fungal infection.
Hi, Priyanjali, and hi, everyone else who are live. Good afternoon. And yeah, let's jump into the topic that's very, very common. So you all been like having the very common questions, and let me answer. So fungal infections are nothing but like they are infections that are caused by fungus, and they are very, very common, especially in humid states like in Chennai, Tamil Nadu. All there, it's very, very common. In other parts of the country is also becoming very common. So it is caused by a fungus basically, and fungal infections won't give you immediate symptoms. So they cause very mild symptoms and they'll be there for a few weeks or months. So there's that key. So most of the misdiagnosis happens there. So you all need to know that any infection is treatable, and you have to consult your dermatologist if you have any skin, hair, or nail related issues.
Right. Now, Doctor, let's talk about how do we identify the condition. I mean, the major problem occurs when you're not able to identify the condition and you're not treating it for a longer period of time. So, how does the initial stage look like?
So initially, if someone gets like to see any rash or any color of the skin changes, like brown patches or a little light colored patches anywhere in the body, especially they start where there's more warmth and moist and where there's more friction. For example, to say first it will start in the groin, in between your thighs, or under the arms or under your breasts. All these are very common areas where the fungal infection starts to happen because there is where there is no more connection with the air and there's no moist and warmth there. So those are the favorable conditions for the fungus to start growing. So you will see a change in color, round annular
Hmm.
rashes that may or may not be itchy during the initial days, and that is when many people miss. You don't have to look for any
Right,
change in skin colors or any red rashes or scaling or mild itching may or may not be there.
right. So, we know now fungal infection can occur at many places in our body. So, is the formation same in all the parts, like wherever it occurs?
No, as I told you, fungal infections can happen over the skin or hair,
Hmm.
scalp, or
Hmm.
nails. So, skin, these are the most common areas where they'll start. And when coming to the
Right.
nails, somebody who stands for a longer time or somebody who works longer time in wet. So, what happens is again, there
Right.
becomes a favorable environment for the fungus to start growing. So they'll be
Hmm.
having nail discolorations, no much symptoms. The nails become thick, sometimes very brittle, broken often, and so all these are very common symptoms for nails. So they'll not have any symptoms. Most people don't come only until they have like more nails becoming, I mean, thick. Yellowish green in color, looking bad, then only they'll be coming to the hospital or the clinic.
Right. Right. So, well, I believe we have lost the connection. We are trying to get doctor connected. In the meanwhile, I can see a lot of people who are already here. a part of our life today. Well, thank you so much, everyone, for joining. Today, we are talking again about a very, very important topic, which is fungal infection and the ways how we can tackle it. And of course, we know about the season right now, how important it is to take care of our hygiene or to protect ourselves from fungal infection. So, everybody, please come up with the questions in the chat box. Make sure you're asking your questions. And towards the end of this live, we will be answering all your questions. We are in discussion with Dr. Indra Priyadharshini today, and we are trying to get her connected. Make sure you all bring your questions up on the screen. Yes, doctor. We will
Hi, sorry, some
continue with the
network
nail
issues.
fungal infection as you were mentioning.
Yeah, so nails, these are the symptoms. You'll see discoloration, the nails becoming
Mm-hmm.
more thick and breaking often. So these are the common symptoms. Coming to the scalp, again, many people have dandruff. So dandruff is also a kind of fungal infection. So what happens is
Right,
when there's more buildup of dandruff, there's also slowing of the hair growth, and it also looks bad, no, when somebody is having some powder scalp, or it just falls on the outfits and all that, and it is also itchy
right,
and it's very annoying. So these are also fungal infections, and these can also be maintained if
right.
taken proper care and taken proper treatment from the derm.
Right, right. Now that we are mentioning fungal infection uh, around like throughout our skin and different parts of our body, let's talk a little bit more about the nail fungal infection. Let's start with that. We know that this is one of the most stubborn kind of fungal infection. We can see nail fungal infection. It usually takes time. So people who are wondering right now that they have been suffering from the condition since a long time, and probably they have been ignoring it, or maybe they have been thinking ki now this is high time, now this is not changing ever, this is how it's gonna be for the rest of my life. So what do you have for them, doctor? Is it too late for them to opt for a treatment at this point of time?
It's never too late. And one thing which I would like to educate people is not every nail changes, not every yellowish discoloration of the nail is fungal infection. That
Hmm.
also you should know. There could be chronic eczema also that is causing nail changes. Okay. And sometimes in elderly people, it is normal to have some nail changes, like how our black hair turns gray. There are some skin and nail
Hmm.
changes that are normal in the aging process. So whoever is
Right.
having thick discolored nail doesn't mean they have fungal infection. So that is why we say whatever abnormality you're seeing in the skin, hair or nails, it's better you come and
Hmm.
consult the dermatologist, and we will tell you what exactly it is. And if it is fungal
Right.
infection, of course we can treat it because it's just an infection. It's not just an autoimmune condition or something that you have to keep maintaining it for the rest of the life.
Right. Well, that brings a sign of relief for all our viewers today. Doctor, let's talk a little bit about the scalp fungal infection, as you mentioned. We normally see children suffering from these kind of fungal infection, and it's usually not easy to manage them when they are in a place where there are, children are on them. It's not easy to manage them. So, how does one parent take care of their children? How do they protect themselves from such kind of infection?
Yeah, nice question. So first comes prevention, right? So
Mhm.
it is very important to wash the scalp for the kids at least weekly twice. That's very, very important. And hygiene plays a very important role when it comes to fungal infection. So the first thing that is
Right.
going to take care is proper hygiene. So they have to wash the scalp weekly twice at least. And they
Mhm.
shouldn't use the same caps every day before, I mean, without washing. They cannot keep using the same caps every day, so they have to clean the caps also, or whatever they wear it on the scalp, they have to clean it. So all that is important. And immunity. Immunity is very, very important. If anybody's immunity is low, for example, for kids to say, some kids have low immunity, they keep getting infections and all that. So you need to get some good foods and like proper high protein diet and vitamin C rich foods in order to maintain their immunity at good levels. So these can be done to prevent. So basically, hygiene comes the first.
Right. Now that we're talking about prevention, doctor, let's talk about prevention in the home setup. What if somebody uh, in a family is suffering from the condition, what sort of preventions should one take in?
Again, the hygiene. So if somebody in the family is having fungal infection, they can easily transmit it to anybody, especially those who are very close to them. So they should make sure that they don't share their personal items, like no soaps, towels sharing, nothing should be shared that we use personally on our body. So that is one important thing. And one thing is washing their clothes separately so that the infection doesn't spread to the other clothes, because it's not just the skin to skin contact that is going to transmit the fungal infection. It's the fomites, means whatever clothes or towels they use, it shouldn't be shared. If they use that, if they keep using the same thing, again, the next person will be developing the fungal infection for sure. So this keeps happening, and we
Right,
see a lot of patients. And hygiene is again placing the for a very important role there.
right.
They should follow treatment
Um,
properly. They should maintain hygiene, and they should complete the course as advised by the dermatologist. That's very, very important. And most people, what they do is they start the treatment, but they just stop it thinking
mm,
it's gone. And they just continue whatever they were doing earlier, like sharing the personal soaps, towels, and all that. And the next person in the family develops the infection and they come to us. So this keeps happening. So they shouldn't believe that it's gone without the advice of the derm.
mm,
That's very important.
right. Right. Well, these are a few of the things we need to take care when we know that someone in the family is suffering from fungal infection. As we all know, fungal infection is contagious, and you need to maintain your hygiene. Now, doctor, there is also confusion regarding fungal infection and bacterial infection. So, how can we differentiate between the two?
Bacterial infections are quick and they are going
Mm-hmm.
to give you more horrible symptoms like pain, swelling, redness, and all that, sometimes fever. Some bacterial infections may mimic fungal infections. For example, those that happen in the underarms and groin, they look like fungal infection, but they are actually not. So in that case, there comes the confusion. So we will take the call, like we will know if it is fungal or bacterial. Most of the bacterial infections that happen, they happen like swellings or furuncular folliculitis type that is very painful, that is giving you a temperature rise, fever, all that can happen in a bacterial infection.
Right.
And they are quick
Right.
and they are easy to treat than the fungal.
Right. Right. Moving ahead, doctor, another sort of fungal infection which happens in the groin area is painful. And normally we see women, really suffering from this condition. As we all know, women are more susceptible um, to have such kind of fungal infection in the groin area, especially for the office goers who needs to use the public toilet on a regular basis. What sort of preventions can those people take in on a day-to-day life?
Yeah, very important question. So the thing is, it's not because you use public toilets. No, it's not that.
Mm-hmm.
It's because you are like, whenever we go to washroom, people tend to clean it, right? So they just put off their panties in the wet skin. That's the major mistake many people are doing. You have to wipe it with the tissue. You have to make it dry and then wear your innerwears. That's very, very important,
Right,
because when the skin is again wet, it is again going to favor the fungal infection growth, right? So you have to keep it wet. You have to make it wet. I mean, you have to, after wetting the skin, you have to dry it. After you dry it, you have
right,
to wear, yeah, after drying the skin, you have to wear the innerwears and all that. And before you use the common restrooms, make sure you clean the closet and you have to clean the seat, and then you please use them, because anybody who had fungal infection who's used that and again you're going to use that, it's again going to spread. So that thing is very
right.
important.
Mhm. Doctor, also tell us about the kind of washes, the intimate washes. As we talk about hygiene here, uh, um, there are people who are also more keen towards hygiene. Extra hygiene, what we call. So, is such extra hygiene important when we are talking about personal hygiene?
Okay, I believe you're talking about the washes, kind of, right?
Right.
Yeah, so there's a big no to be washed because women's vagina has a proper pH naturally to prevent the growth of unnecessary organisms, and in turn it prevents infections. So if you're using
Hmm.
any specific V wash or something of some kind of vaginal washes, it's going to alter your pH. It's going to make it more alkaline. So what is going to happen
Right.
is there's going to be growth of more bacteria or fungus. So some unnecessary problems you're actually taking in. So don't use any extra washes. You just have to use water. That's it. And when you're taking bath, just soap and water. No extra washes or no extra vaginal washes are needed. So please don't use V
Right.
washes for no reason. Don't use at all. It's not needed. It's going to alter the vaginal pH and it's going to cause you unnecessary problems there.
Right. Now, let's also talk about the treatment options which are currently available to treat fungal infection, doctor.
Yeah, so it's based on where the infection is. Is it on the skin or hair or nail? So that itself
Mm.
is different. And it depends on how long you have been having it and in how many
Right.
places it's there. If there's only on the skin, there's only one area is involved. For example, if there's only the groin that is affected, in between the thighs only you have fungal infection, then we would give you
Hmm.
only topical antifungal creams or lotions.
Right.
So that would be more than enough. And to reduce your itching sensation, we will give some antihistamines, the tablets that are going to reduce the itching sensation. That's all. But if you have skin fungal infections in more than two places, then we would prescribe you oral antifungal drugs. So those are very, very
Right.
important when you have in more than one place. Okay. And we will
Right.
be giving it for 3 weeks or 4 weeks accordingly. So you should follow
Right.
the treatment properly without leaving gaps in between. That's very, very important. When it comes to nail, again, you said it's been like chronic. It is chronic only because nail itself will grow at particular rate only. So for nail fungal infections, we would give treatment for 3 months at least. And toenail infections for the leg nails infections, then we would recommend the treatment for at least 6 months. It will take that much time. You have to be patient only. That is one thing. And regarding the dandruff part, it is easy to manage. You just have to um, stop applying scalp oiling should not be done, and you have to wash your scalp weekly 3 times for the adults. That's very important. Again, hygiene plays a very important role, and that's it. The scalp fungal infection in kids or even in the adults that happen are tinea caries. That is a fungal infection of the scalp. That again will take
Right.
1 to 1.5 months if treated in the early stages. So everything will
Right.
take weeks or months only if you note, I have mentioned. It won't be cured in days. That is very, very
Right.
important.
Right. So, well, I would like to say to all the viewers who are watching us right now, this live is to educate all of you regarding fungal infection. We are not providing any treatments here, and it is not possible to provide a treatment as a whole. The treatment has to be different for each individual because the condition looks different for everyone, and that is why we always try to tell you all that please do not self medicate in this case, because we know the kind of medications which are available for fungal infection, the kind of medications that treat fungal infection, be it ointments or be it oral medications. We know the kind of medications which work for fungal infection, but it is not safe. Never suggested, because it does not work like that. You need to get an expert help, and every single time, because we know that fungal infection is something which will reoccur, which has a tendency of recurrence, and every time you see a recurrence, you need to visit the expert for that. We see a lot of people, doctor, who continue the medication. Suppose they have been to the doctor for the first time and the doctor has suggested some medications for the same, and as we all know that people, they tend to leave the treatment in between because they see that the changes are there and then they are fine now, and after a few days the uh, the condition is seen to be flaring up again, and that is the moment they just take out the previous prescription and they visit the chemist and they ask them to just give the medications. How, what do we have for this, doctor? What can be the worst case scenario when people are doing such things?
Yeah. almost like more than half of them who are suffering from fungal infection do the same mistake. What they think is
Right.
they think it's gone and they'll stop the treatment. And after 1 or 1.5 months, again they'll come back or they'll just use the same prescription. So I tell all of my
Right.
patients the same thing. More than consultation, the first consultation, coming for review and follow-ups are very, very important.
Well, I think we are trying to get Doctor connected. There is a slight network glitch. Glad everybody's coming up with their questions. I can see a lot of questions coming up on the screen. Thank you so much, everyone, for joining us in today's live. As we all know, we are talking about a very important topic, which is fungal infection and its management, the preventions that we can take in order to stay away from fungal infection. And we were talking about the importance of not self-medicating. The worst thing you're doing to yourself when you're suffering from any condition, especially fungal infection, it can be worst, and the kind of effect it will have on your health. We were discussing about it. We are trying to get Doctor connected. In the meanwhile, you please come up with your questions, everybody. The chat box is open for all of you. Any problems regarding fungal infection, any issues regarding fungal infection, please make sure you're coming up with the questions in the chat box. Well, we are extremely sorry for the network glitch, everybody. We are trying to get Doctor connected, and we will want you all to please come up with the questions because I can see a lot of questions coming up from the viewers. In discussion with Dr. Priyadharshini regarding fungal infection today at All About Skin Wellbeing, our page, our official page at Facebook. Uh, by the end of the session, we request all of you to kindly subscribe and follow our channel regarding such informations. Um, we come up with such lives with doctors throughout India, and we share insights. I think we have got Doctor connected. Well, everybody watching us, everybody waiting. Thank you so much, everyone. Doctor, am I audible to you? Well, thank you so much, everybody, for bearing with us. We are still trying to get Doctor connected. We have a lot of questions to attend, and we are trying to get Doctor connected. In the meanwhile, we will request you all to please be with us. Please bear with us, because the rest of the questions, the coming questions, and the coming answers. Right, we can see you, Doctor, now. Perfect. As we were talking about self medication,
Yeah.
yes, Doctor.
So we were talking about the recurrence. Yeah. So people are not supposed to share the prescriptions because prescriptions are individualized. So please don't share the prescriptions and follow the treatment accordingly. And in this case, rarely recurrences happen. But what people do normally is sharing prescriptions, stopping the treatment before the advice of the dermatologist, and these are the causes for recurrences. So please don't stop until we say otherwise.
Right. Well, that would be the suggestion for all of you who normally does such things. Please try and avoid it. Doctor, I can see a lot of questions coming up from the viewers. Let's take those quickly. The first question comes from Tanishka Rajoria.
Sure, sure.
Asks, I have white
Mhm.
patches on my chest after the rain. Could it be fungal infection?
So firstly, are they itchy or predominantly over the chest, back, and arms if they have? It could be versicolor, which we say it is also a fungal infection. So that can also be
Right.
easily treated. So if you have doubts in if it is fungal infection or vitiligo, please do consult your dermatologist and they will examine the skin problem, the skin lesions, and then they will let you know what it is.
Right. The next question, Doctor, comes from Deepak Saxena. Asks, why does my wife's fungal rash keep coming back even after using cream?
Again, the same point. Firstly, I wanted to ask them if they properly followed the prescription, if they stopped the treatment before the advice of the dermatologist. So these two are the most important questions I would like to ask. If they didn't do any of these, then they have to take proper treatment once again and follow the advice properly. Because once it is gone, mostly it trigger if you're following hygiene measures correctly. But before proper advice, if you stop the treatment thinking it is gone, it is actually not gone and it is still there in the skin. So please do visit your dermatologist and follow their advice properly. It can easily be treated. So don't worry about the treatment part. It just takes some time. That's it.
Right. The next question, doctor, comes from Tina Bhargav. Asks, could a bald, itchy patch on my child's scalp be a fungal infection?
A bald patch again. See, it's just smooth bald patch means it may not be a fungal infection. It can just be alopecia areata. Once again, that's very common in children. So, supposing if the bald patch has some flakes or powders, it could be fungal infection. So, whatever it is, we need to check it. After we checking it, we will let you know what it is.
Right. The next question, doctor, comes from Desu Desai. Asks, can I treat fungal infection using neem or coconut oil instead of medications or medicines?
Once again, please don't apply oil. Oil is like feeding the fungus. So please don't use oils at all. And you cannot treat them naturally, really, to say, because nowadays fungus have become very strong and they're resistant to any kind of treatment. So you have to follow them correctly, and you cannot apply with oils, especially. It's like you're feeding the fungus, so it lives on your sebum. It lives on the oil only. So if you give more oil, what will happen? It's going to increase only. It's not going to reduce.
Well, that was one a very, very important suggestion for all of you. The next question, doctor, comes from Firoz Khan. Asks, can we reuse the clothes which we have worn during the fungal infection?
No problem. If you had properly washed it and sun dried it and ironed it, it's good. You can
Mhm.
go for it.
Right.
It's just not going to be
The,
there permanently, even after washing. You have to wash your
right.
clothes
The next,
properly, sun dry it and iron them, and then you can reuse them.
right. The next question, doctor, comes from Ria Jain. Asks, do frequent fungal infection after travel mean I'm catching it from new places?
Again, you need to check if it is really frequent or it's just the old thing that is still there and that has again started to grow because you stopped the treatment in the middle. So you need to make sure. Nextly, I need to know the age of the patient because you need to be very careful with the immunity. If you are 30 plus or even in younger age, people get diabetes. So you need to check your sugar levels because diabetes is something that is going to keep your immunity at the low level. So you need to check your immune status. Mainly, you need to check if you have diabetes or you need to check if your immune status is okay. If you don't have any immunocompromised conditions. So you need to make sure that. Otherwise, it's not very common for people to get recurrent fungal infections if they are following everything correctly.
Right. The next question comes from Ria Sathi. Asks, does pet cause fungal infection? Pets.
If the pets are infected with fungus, they can also transmit because, again, to say it is an infection and any infection can be transmitted, may it be bacterial, fungal, or viral. You need to make sure if the pet has a fungal infection or not. Just the healthy pet doesn't cause infection, doesn't spread infection to you if it doesn't have.
Right. Right. The next question, doctor, comes from Sumit Sen. Asks, do repeated fungal infection in the genital area mean my immunity is low?
Maybe you need to check. You need to check and you need to make sure you're following the treatment correctly and check your immune status
Hmm.
by checking the sugar levels in the blood.
Right. Right. And I think we have one last question coming up from Muhammad Imran. Asks, is toe or nail infection permanent, permanently curable? Have been using nail rocks for quite few months, still persistent. Please give your opinion.
Yeah. If it is, if it's there since chronically, or if it's there since more weeks or months, you may need oral antifungals. So you need to consult and you need to check your other functions, that like liver function, renal function, and if everything else is okay, then we would prefer giving you oral antifungals. And it's not
Right.
permanent.
Well,
Of course, to say again,
right,
any infection is treatable. So we can easily treat it.
right. Well, doctor, we had a very informative session with you today on the topic of fungal infection. Before we take a leave, any take home message for our viewers who has watched us
Thank
so
you.
far?
Yeah, I would like to mention the rule of two for anybody who's having fungal infection. So there's something called rule of two, means you have to apply the antifungal creams twice daily after taking bath. Means you have to take bath twice daily. And after you take bath, you have to apply the anti-fungal creams or lotions over the rash and around the 2 centimeters, the around 2 centimeters of the margin, you have to spread the cream or lotion and then you have to apply, because that is when we are going to limit the spread of the rash. That is important.
Right,
And this rule of two is very, very important, which everybody have to know who's suffering from fungal infection. Twice taking bath, twice applying the cream, and beyond 2 centimeters of the margin of the rash, you have to apply the cream. And after all the rash fades away, also beyond the
mm-hmm.
rash goes away, you have to apply the cream for 2 more weeks extra so that it is completely gone, because once
Right.
you don't see the rash on the skin doesn't mean it is fully gone, it is still microscopically present. So please do continue the treatment for 2 more weeks extra and you'll be relieved then.
Well, that was expert advice for today, and that was Dr. R. Indra Priyadharshini for us. Thank you so much, Doctor, once again for your valuable time. It has been a very informative session for our viewers today, and we look forward to many more such sessions in coming time. Also, thank you, viewers, for your excellent participation. For more information and updates on skin health and care, stay connected on our Facebook page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and stay healthy.
Thank you all for giving this opportunity and educating the patrons out there. Thanks.